Hi again, it's Dr. Gordon. I get asked all the time, what is obesity actually and how should it really be defined? And the confusion makes sense because medicine has done a terrible job of explaining this. So first thing, we have to be honest about BMI. It was created in the 1800s using data from white European men, and it was designed for population statistics, not for diagnosing disease in individuals. Using BMI as a clinical shortcut today is sexist, racist, and outdated. Women have different fat distribution, different hormonal signaling, and different risk profiles. People of different ethnic backgrounds develop metabolic disease at different body compositions. So BMI ignores all of that. And here's what actually matters. Obesity is not a look, it's not a moral label, and it's not synonymous with extreme weight. Obesity is a disease of dysfunctional adipose tissue. It's fat tissue that's inflamed, hormonally active, and disruptive to normal metabolism. Where fat is stored matters more than how much you weigh. This is why waist to height ratio is one of the best and simple clinical tools we have. Central fat around the abdomen is metabolically dangerous. It drives insulin resistance, inflammation, and cardiovascular risk. You can have normal BMI and a waist to height ratio and have a high waist to height ratio and have real metabolic disease. And you can have a higher BMI with a lower waist to height ratio and a much lower risk. This is where people get stuck. Society thinks obesity means extreme bodies. Medicine relies on the outdated metric of BMI, and patients end up feeling like they're not sick enough for help, but not healthy enough to feel well. So here's the truth. If your waist circumference is increasing despite stable habits, if fat is shifting towards your abdomen, if hunger feels louder than your discipline, that's physiology changing, not failure. Obesity is a medical diagnosis meant to open the door to care, not close it. And if you've been dismissed because you don't fit an outdated male-centered metric, that's a failure of the system, not you. You want a waist to height ratio of 0.5 or lower. That's metabolically healthy. Follow me for medicine grounded in physiology, not blame.